trigeminal neuralgia, which is also called as tic doulorex. This would be characterized by severe lancinating or a stabbing nature of pain across one side of the face of a patient across the distribution of the trigeminal nerve. The pain will be lasting only for maybe few seconds to a max of 2 minutes, but it's going to be so excruciatingly painful that you will notice that there would be a change in the facial expression of the patient. He's going to wince with pain, and because I said there would be sudden onset this pain present, so there is a possibility that the person might suddenly turn his head like this, the movement that I did, which is why the word tick is also used to describe the presentation of this patient. Let's now look at the pathophysiology behind development of this condition. And at the outset, I would like to say that if it's a bilateral trigeminal neuralgia, then multiple sclerosis is always to be considered in the differential, and multiple sclerosis is discussed separately in the app. Now, from the pathophysiology perspective, there are two reasons. The first one would be, I can label point number one as idiopathic, but what is happening in this case is the ectopic generation of action potentials in the nociceptive part, or I can say the pain sensitive efferent fibers of the trigeminal nerve. You see, trigeminal nerve is going to be sensory to the face. So what I'm saying is there is a abnormal ectopic generation of action potentials in the pain sensitive component of the trigeminal nerve. That's the efferent fibers of the trigeminal nerve, which can be managed with carbamazepine or other drugs that we'll discuss subsequently. But from the exam perspective, he can definitely ask you a vascular cause as well. And though it is mentioned even in a diagrammatic format on the right hand side, I have to emphasize this. This could be a potential one-liner question. Trigeminal neuralgia could be seen due to which blood vessel pressing on the trigeminal nerve? Then answer would be superior cerebellar artery. It may not always be an artery. It can be a tortuous vein as well. And the question then arises that after all, the vein is, or the artery is pressing on the trigeminal nerve, and the part of the trigeminal nerve that it is pressing is actually myelinated component. I said that there's an artery which is pressing on the trigeminal nerve, which is myelinated, and this myelinated part of the trigeminal nerve is actually not carrying pain sensation. But then how is the patient perceiving this pain? So you know that this myelinated component of the trigeminal nerve will be electrocoupled. I am just using a concept of physics, electrocoupling. I mean, electrically parts are linked. So the myelinated part of the trigeminal nerve is electrocoupled to the unmyelinated fibers which carry pain sensation. So even if the pressure is on the myelinated component and there's a demyelination, but because of the electrocoupling of the myelinated component of the trigeminal nerve with the unmyelinated fibers which conduct pain, that is why the pain sensation can be perceived in these patients. This will also explain why, like, a patient with trigeminal neuralgia is telling you, the doctor, when he's using that electric toothbrush, and the vibration which is being produced by the electrical toothbrush is triggering an episode of trigeminal neuralgia and a lancinating pain across one side of the face. Or he says, I'm using a electrical razor or even a traditional razor, and once it goes over a particular area of the face, I just feel as if somebody has cut my face with a piece of glass. I mean, most Indian patients would say that. I mean, we don't expect them to use the word lancinating pain. So he'll say, I feel as if somebody is cutting my face with a piece of glass or a blade, or some might just say that I get a electrical shock-like sensation on one side of my face. And there are certain trigger zones where we'll talk about those triggers. We'll talk about the trigger zones on subsequent slide. But like I explained, once the shaving razor goes over a particular area, or like he's using an electrical toothbrush which is producing vibration, then that vibration will be affecting the myelinated nerve fibers which are compressed. But because these myelinated nerve fibers are electrocoupled with the unmyelinated fibers which conduct the pain, so pain sensation would still be perceived by the patient. And once we got the pathophysiology right, especially this concept of artery/vein, though both causes have to be remembered,